So everyone who's joined us, thank you again for joining the webinar. What we're going to do now is open it up to the 4 companies that you see on the screen here. Each of them will present for a few minutes of their solution, and then we have the chat window open now, so feel free to ask questions as people present. And after people have presented, if you don't mind directing your questions, just writing their name of the company or the presenter to them, just so we can collate it, that'd be fantastic. So Ville, I'll hand over to you. Are you able to start your screen sharing, or shall I?
Yeah, let me try to start.
No problem.
Probably works.
Yes, that's fantastic now.
Perfect. So, hi everyone. So I'm Ville from Ninchat, and we are a company from Finland, cloud-based messaging service, and we create messaging solutions in customer look and feel. So that's different types of chats, different kind of video consultations, video messaging, and also bots for web, mobile, and bots. And what we've been experiencing now during the last 4 weeks has been kind of the tsunami of demand in digital messaging services. So everybody wants them right now. So about our company, we are mainly focusing in the healthcare industry. So there's about 50% of our customers are hospitals or health service providers. Then we also have some universities, public organizations, and official organizations. So that's what kind of company we are. But during the last 4 weeks, so we've been delivering. So we've been just delivering every day new kind of solutions. So what we've seen a couple of thousand doctors onboarding Ninchat, starting to offer the online consultations, and we've seen over 10-folds in the volumes of that. We did for City of Oulu a Corona Infobot that was done in 2 days, so it's rather fast deliveries. Enabled for City of Rovaniemi remote meetings for family, child welfare organizations, and disabled person services. So when kind of the Corona hits, then it's kind of illegal to have in-person meetings. So then all the organizations need to somehow cope with that. So how can we help the customer organizations then to enable integrated, secure digital meetings and fast? So that's been the cause. Then there's a kind of a group of cities. So for Keusonto, that was Corona helper chat. Then for the government, state insurance company Finnvera, all the companies needed to have loans, so it's kind of like a loan collateral advice infobot that can help with the people. And then launched a couple of new digital doctor services for our customers, and then all kinds of remote meetings for different kind of organizations, such as child and mother shelters for their one-on-one meetings with the clients. So it's been quite busy. I wanted to showcase a couple of products that we were delivering. So the chat and video messaging is the most popular one. And here's the example of the infobot, where you're gonna find advice from City of Oulu. And then we've got a cool product called Notifier, which allows you to share a specialist over multiple locations. So for example, a neurologist or specialist doctor over multiple hospitals. So while they're on the move. So how to get that. And looking for business partners, we have also activities in Asia. So we are cost efficient and fast to deliver, and this is what you get from us. So messaging in your look and feel for your company, and we tailor the security as well according to your need. And here's my contact information. Please contact me. We're very much looking forward to cooperating with you. Thank you.
Fantastic. Thank you, Ville. Let's just pause there for a few moments, see if there are any immediate questions, and then we can jump into the next presentation. Let me just share my screen again. If anyone has any questions, feel free to just add them into the Q&A or the chat window and pick them up.
So I assume it's me that I'd start presenting Dignio. Is that correct?
Yeah, if you want to jump in now, I think we'll keep any more questions until the end.
Right. So thanks, guys. Just a quick reminder that Dignio is a Norwegian connected care company. I wanted to show a little bit about how we have been working with hospitals and municipalities over the past few weeks and implementing our solution. So the main thing that we have been addressing is that the local healthcare today is a lot based on, you have the telephone, you have a physical presence, you need to like be together. And that creates challenges related to capacity. You have risk of infections for both patients and employees. And it's also very hard for the clinicians to follow up on patients outside of the clinic. So what happens when you have a COVID-19 patient, they go home, and very often you will have the deterioration happening very fast. So how to be able to discover that in an efficient way. So what we have offered, and this is basically building out on a cloud-based solution where we create a virtual clinic. This allows the healthcare organization to register all the patients that they want to follow up. You equip the patients with an app on their site where they will be reporting symptoms, they will be reporting vitals, etc. There will be a automatic triaging happening so that you can get, as a clinician, you will be able to prioritize who are the patients that needs attention. And communications happens with the patient through either a chat or a video solution. And in addition, it opens up for to provide information to the patients. So this is then like really an addition to the local healthcare. So typically what we have been seeing is that the local municipalities or hospitals, they have their own process for taking care of their COVID-19 patients, but then they are adding on this virtual clinic to make it more efficient and to follow up on patients closer. So what we have seen is that it has been applied for COVID-19 patients in home isolation. Others have implemented a solution to just closely monitor high-risk patients, people with underlying conditions, and in the cases where you see an early discharge from hospital, because the capacity constraints, people are being discharged from hospital, how to follow up on these patients. So this is just like to show that the healthcare personnel will access through a web-based interface, and the patient sits and report in their homes through either an iPad or their phone. You have telemedicine functionality, you have remote patient monitoring functionality, you have symptoms reporting, where we also have a validated form for COVID-19 and information page. Today, these are like some of the selected customers that we work with in Norway, where we have a good mix of municipalities and hospitals, and among them Oslo, which is the capital in Norway, where we are part of the infection teams that are the solution they use when they want to follow up on their patients on a day-to-day basis. So similar to what Ville presented, we are a cloud-based solution. We can deploy anywhere in the world, basically. And we have operations today in Norway is our core market. We are also present in UK and in China. So we have a team present also in China. Yeah, I think that's it. Happy to answer questions or yeah, after.
Thank you, Ole. Much appreciated. I think you've got one question actually in the window now. Can you see that at all?
I'm not really sure. Is it in the Q&A?
Yeah, I can. It's in the chat. I'll read it out to you. Does the app require much training or education from the patient side to use? And also, does it require much hardware? For example, sensors, cameras, thermometers at the patient side?
Okay, so the app is very easy. So we actually had the app first launched, or like we have been a company since 2013, essentially. So we've been working on this for a long time. There's thousands of patients on the solution today. So user friendliness on the patient side, we have users up to 96 years old using the app. Hardware wise, it's available on a bring your own device solutions. You just download it from App Store or Google Play. In terms of the vitals, we have a set of integrated devices, but it's also possible to register using patient's own device. So for example, a temperature measurement, you can either use the integrated thermometer or you can enter in your temperature yourself into the solution.
Fantastic, thank you very much. I think that's all the questions we've got right now. So I think let's move to the next presentation. Vidar, are you able to start sharing your screen? There we go.
You see it?
Yeah, perfect. Thank you.
Okay, I will go on. The corona pneumonia is very different from any else pneumonia I have seen as an intensive care doctor. The common experience that ICU doctors have is that the patients they intubate all came too late to the hospital. The reason is a phenomenon called silent hypoxia. The lungs fail to deliver oxygen to the blood without the patient noticing. Not all patients with COVID-19 virus infection will have silent hypoxia. The challenge is therefore to identify those who develop this condition and admit them to hospital before they get too sick. Early signs of silent hypoxia are first increased respiration rate and then decreased oxygen saturation in the blood. Therefore, close monitoring of patients at home is crucial. Trying to change the this one. Yeah. In this respect, Omsyn has proven useful for early detection of silent hypoxia. Omsyn collects vital data from a wide variety of medical sensors and provide real-time readings to healthcare providers. The bed sensor we use is an accelerometer attached to the bed frame. Without being in touch with the patient, continuously sends vital data every second as long as the patient is in bed. The huge amount of data generated is analyzed using artificial intelligence. Omsyn will help detect and predict alterations in health status. Combined with readings from other medical sensors, Omsyn becomes a powerful tool for following up on patients with COVID-19 infection at home. The bed sensor will early detect increase in respiration rate. The patient will then be asked to do a pulse oximeter measurement. The patient needs only to put his finger in the pulse oximeter, and then the reading will automatically be collected and sent to the user interface. This graph, if I can get it, yes. This graph is from an actual patient with COVID-19 being treated at home. The graph covers 3 days, March 24 to 26. In this case, the graph granularity is 60 minutes. The line represents the median reading every 60 minutes, while the bars represent the maximum and minimum values. As can be seen, this patient is improving. The heart rate is decreasing, the respiration rate is decreasing, but most interestingly, the reading of the heart rate variability is increasing, as well as the relative stroke volume. Remote monitoring of patients with sensors not requiring aid from either patient or helper is very useful because it reduces the risk of transmitting the virus. Omsyn is proud to be able to help in fighting the corona pandemic. Thank you.
Thank you for sharing. Let's just see if there's a few questions for you. If not, we can pick them up at the end. Let's see if there's any questions later, but thank you again, Vidar, much appreciated. And now moving to Julian. Julian, are you able to share your screen?
I'll give that a go. Okay.
Perfect.
You can see my screen okay?
Yeah, perfect, thank you.
Okay, so I'm Julian Parr. I'm from PaloIT. We're a global software services company, but our head office is in Singapore. And we've been working on Virtual Bed, which is a remote care platform for COVID-19 patients. And it was actually inspired by some work we were doing with GovTech Singapore on monitoring hypertension patients in their own homes. So what's the current situation? Well, we know that vast numbers of people can become infected with COVID-19, but many are going to have mild or moderate symptoms and are not going to need to attend hospital. And that's where Virtual Bed comes in. So how does it work? Well, so similar to some of the other solutions that have been spoke about. There's a mobile app where people can, where patients can track their temperature, their heart rate, pulse rate, things like this. And then those observations are surfaced to healthcare professionals in a dashboard. So how does it work? Well, the patient observations are triaged based on their news score, which is the early warning signs score developed by or implemented by the NHS in the UK. But we can tweak this for any sort of similar algorithm. So patients are ordered by their news score, then by the number of comorbidities, and then by the age. So the idea is that it surfaces individuals who are most likely in need of attention to healthcare professionals. So with the patient journey, where does it fit? So it kind of fits between the digital symptom checking tools and hospitalization. So one of the outcomes of a symptom checking tool might be, hey, go and download Virtual Bed from your healthcare organization, and please start tracking your start tracking your metrics in your own home. So yeah, so this is the app site. So this is what the patient sees. So a couple of screens there showing the examples of the information that we collect. So that's the temperature one. It also collects respiratory rate, heart rate, SpO2, and systolic blood pressure. And then patients can also log comorbidities. Obviously, those guys are more at risk. And then the assessment is used to help the patient decide what to do next. So that might be to come and track again in a few hours, but equally it might be to call a support number to get some help and advice on what to do next. So this is the healthcare professional dashboard. So there's really two parts of it. So the patient list, which as I said before, is organized by their news score, the number of comorbidities, and then the age. And then a healthcare professional looking at a patient record can look at the details of that with those metrics plotted over time, their news score, and all the other information. They can add logs in there, and then by clicking on the, if they need to make contact with a patient, they can click on that contact number and start a video call just by whatever they have installed, either Skype or FaceTime if they're on Mac. So this is all just through the browser. So yeah, it can be used in conjunction with other hardware, or it can be used on its own. So yeah, it can use with a handheld oximeter, or things like Fitbits for pulse rate. So it integrates with all these different devices. How's it built? So it's built on Microsoft Azure. It's it's a cloud native design pattern, so it scales very well. Yeah, the front ends are React Native, so they're for iOS and Android, and then the healthcare professional application is React App, so it will work on any sort of modern browser. Yeah, how to roll it out? So all the infrastructure is built using Terraform, basically ARM scripts. So you can set up that infrastructure very quickly on Microsoft Azure. Our deployment time for a healthcare organization is around a day, but getting the applications through App Store can take a little more time than that. Then yeah, some notes on security. So yeah, it uses all the out of the box security standards that you might expect, with data encrypted at rest and encrypted at transit. Also, when a patient exits the platform, hopefully they get better. There's a separation between the patient metadata and their observations. So when a patient exits the platform, their metadata is deleted. So there's no longer their name, their date of birth, or anything else stored in the platform. That's all anonymized, and only the observations are stored in the platform. So those observations on temperature and everything else, that will persist for people to do research in the future. Yeah, so that's a bit about virtual bed. There's a test app if you want to play with it yourself, and also you can have a look at the console as well. So if you play with the test app, you'll hopefully see yourself pop up in the console, and you can see how it works like that. Super, that's me.
Perfect. Thank you very much, Julian.
You're welcome.
So a few questions popping up. So I think one of the first questions is to Vidar. So Vidar, I'm not sure if you can see this. Does Omsyn measure body temperature, and can it use a Bluetooth connection?
Yes. Yes. I will let my colleague Ali take this further on.
Okay. I think good day, everyone. So for the technical questions, I can help answering some of them here at least. So the way basically Omsyn operates is that it is a passive device. So basically it continuously monitors patients and doesn't really require much input from the patient. Now to answer the question about like Bluetooth sensors, yes, of course. So if, for example, a patient has access to a Bluetooth-based thermometer, and we provide some that are compatible with the system, then as soon as basically they measure their temperature, the data is harvested and submitted directly to the system for doctors and clinicians to have a look at. I hope that basically answered the question.
Fantastic, thank you. If there are any more questions?
Yeah, there you go.
No further questions just yet. Let's just stay a little bit longer. guess this is an open question to the participants and maybe to pick up on some of the discussion from the main room. Any of you feel free to jump in here, but have you encountered any kind of particular challenges in developing any of your solutions or adapting them in such a kind of fast moving situation?
I'm happy to take a shot at that, Julian from PaloIT. I guess for us, we're an IT company. We, our sort of day jobs are in developing software very, very quickly. So the tech part of it isn't a challenge for us at all. I guess what the challenge for us has been is getting this in front of the right people at government level for rollout, and then the other thing is to get feedback on the application and from a healthcare professional perspective, because a lot of the guys that we would normally talk to are really hard worked at the moment, and so if you want to try and talk to frontline staff about how easy it is to assess a patient and so on and so forth, it's very difficult to get that user feedback because they have a lot on their plate. But I guess one of the ideas about all of these remote monitoring platforms is that it allows other it allows a wide range of healthcare professionals to provide care. So healthcare professionals who themselves might be in risk groups through these types of platforms don't have to meet patients and don't have to put themselves at risk. If there's a shortage of PPE, those healthcare professionals, again, they don't have to worry about shortages of PPE because they don't have to interface with the patients directly. But then on the patient side, obviously, with these types of platforms, you're trying to give them reassurance that they can, that they're okay, and they need to sit this thing out in the comfort of their own homes, knowing that they've got the support. And in that case, it removes the risk for infecting others while they're traveling. So in terms of the technology, it's the technology is not a problem here. Getting the right people to look at these things, from our perspective would be.
Thank you, Julian. Just before we jump into some other reflections, one question for PaloIT on the chat actually. How is virtual bed being tested out in Singapore, and how is it being used in other countries?
Yeah, so we haven't rolled this out yet. We've been in contact with the GovTech guys, so we've done a presentation to the GovTech guys in Singapore, and it's also being assessed by eHealth in Australia. So yeah, so it's in an assessment phase at the moment.
Fantastic, thank you. And an open question to all the other panelists. For the companies delivering home services through software, what is the proportion of customers that combine the app or the software with hardware devices?
Maybe I can just give a go from Dignio's side.
Thank you.
Yeah, so what we have seen, it's been quite interesting actually on this point, was that we expected like the vital signs, the hardware component, to be like the most sought after component that the clinicians wanted to equip the patients with. And that's partially true in the worst cases, but what has really been, what we have seen the highest demand is to have the validated questionnaire that allows the patient to report symptoms that we have tested and validated together with the municipalities in Norway, together with the Directorate of Health. So we have that form. So really just by reporting the symptoms and tracking the worsening in symptoms, you are able to intervene early. So that's like from the clinical standpoint that we have seen. And what they do is that for the worst case, like where you're very unsure, you do equip with pulse oximeter and a thermometer as well.
Fantastic, thank you.
Can I add on from Omsyn that our experience is that we deliver hardware together with software. The passive sensors that we are using that requires no participation from the patients or from anybody else, you just have to plug it into the electricity and then it works, has been very successful in identifying patients at risk. So we are currently using that in a scientific study with the University of Oslo in cooperation with the University of Bilbao in Spain.
Yeah, I could comment on the area on the both questions actually. So to kind of how to deploy fast is kind of like to having a platform that is based on APIs and ready-made elements. So then we are, for example, it's possible to translate to Thai the product. The customer experience is totally different type of character sets. So in a matter of 1 day, and also to customize the flows in different kind of situations, like what we've done with the hospitals with the symptom mapping. So you can have a chatbot that is doing a validated symptom mapping according to your needs and in your language in a rapid way. Regarding these hardware devices, we have this mobile app SDK. So if you have your own app, so then you could have access to the data, let's say from the mobile device, and then transmit that as metadata. So we don't ship any devices, but then you could have your own app, include the messaging functionalities, like make your own crew app type of thing, and then have it collect all the necessary equipment data that's available.
Thank you, Ville. Actually, just to pick up on your points there on APIs, we've got a few government attendees in the room here, and obviously the focus of the event also on government. As all of you are developing these solutions, what are your kind of lessons learned about interacting with government and healthcare services around the provision of things like APIs or policies or processes?
Yeah, I can maybe start with like having an open mix. So it's really kind of data security is number one. So about like location data, like in some countries, like in Germany, for example, you should have it's not even enough that the data is in Germany. You would need to have it in the hospital premise. So how to do that in a cloud environment is a big question. So you need to kind of really plan it. So and then having a customizability, so how long the data is stored per customer per use case. So it is. I think that's been the kind of like to having all of these variations which are like different massively from country to country. So we are having mainly Europe and some Asian customers. So, but that's been the biggest area is kind of like the versatility of the data protection requirements.
Thank you. Just to go back to the panel, the questions from the audience. Julian, you've got a question here. Do you see the app eventually being used for continuous tracking of employees working from home, i.e. rolled out by organizations when whatever the new normal looks like sets in?
Yeah, that's an interesting question. So, I mean, what the virtual bed's designed to be rolled out by a healthcare organization, because you need healthcare professionals to be able to look at the patient list and then maybe contact a patient and have a conversation with them about how they're doing and decide what to do next. But if a company had that kind of capability, then indeed it would be possible. Now, what we intentionally did was base the scoring on a very well-known track and trigger scoring methodologies. So it's sort of a trainee nurse or trainee paramedics would all understand this scoring system very, very quickly. It's widely used both in in pre-op and post-op circumstances. So you know, there's a very wide range of healthcare professionals who could provide you know, provide help through this kind of platform. So yeah, so it definitely could be used in that way. And then in some of the conversations that we've had with government, there has been interest on how it can be used outside of COVID-19. So of course you can see applications in pre-op and post-op scenarios where healthcare teams, you know, would like the same sort of metrics, so they can plan and provide care for patients coming in and out of hospital. So yeah, the idea itself has many different uses.
Thank you. And a more general question to the other panelists. Have you found any interesting insights with the data that any of you are collecting, either with regard to COVID-19 or other diseases? And I see, Vidar, you've already added a little bit there, but any other panelists want to pick up?
Well, I can tell you that we have been using the bed sensor for some time and have, especially in the COVID-19 patients, seen a number of very interesting developments, especially the different relationships between the different parameters that we monitor. I would like to point to the heart rate variability, which is a parameter that not many people monitor. It has been a very significant and sensitive parameter for deterioration or improvement in the condition of the patient.
Fantastic, thank you. Do any other panelists want to jump in there?
Yeah.
No. Just one final question from my side. UNDP works in about 170 countries around the world, and obviously many of these are skewed towards what we call developing countries. For your respective solutions, what kind of relevance do you see that they have for the developing world?
Could you repeat the question? Sorry, one more time.
Yeah, no, sorry, the connectivity is a bit hit and miss. So UNDP obviously is focusing a lot on economic development around the world. Your respective solutions, how do you see them playing a role in developing countries?
Sure, I can give it a go.
Thank you.
As well, and like for example, with the Dignio solution, with the ability to connect clinicians and patients in a secured manner, I think it's quite applicable in any case, or like anywhere in the world. And for the and I guess in the developing world, where it's the resources available to take care of the patients who really need it, it's really a scarce resource that is hard to get by, and to be able to follow up on patients in a more effective way, give them the safety, give them the information, give them the ability to feel that they are looked after, and also to respond in the cases where it's required. I think it's also possible to deploy it in the emerging world. I used to live 4.5 years in Jakarta, Indonesia myself, so I can just imagine like what the healthcare system is going through there now. But I know that everyone that lives there has a smartphone, and that there are, so if you find a way how to connect those patients with clinicians and allow them to communicate and to identify the patients who need it the most, I think that could have a great application.
Ville, Vidar, Julian, any other reflections there?
Yeah, so from our part, you know, we're offering all the code for virtual bed as open source, so anybody can have that. And you know, the cost of the hardware that supports these things is coming down very quickly. As Oli said, many people have smartphones, and you'll find that you know, there's apps for measuring things like pulse rate, for measuring respiratory rate. So there's companion apps that people can use as well. You know, I picked up them in, this is an oximeter. I picked this up for yeah, around about $25 US. These, you know, the hardware that you know, that supports this type of care is becoming more and more accessible. So hopefully that's going to help the developing nations use this type of technology to support their citizens.
Can I add to that and say that I think technology used in the favor of the many is a necessity. We are using artificial intelligence and augmented reality as new tools, and I think these new tools will be extremely beneficial also applied at developing countries.
From Ninchat, like as Ule mentioned, similar from the patient part, mobile chatbot assisted triage with video consultations. That's with the clinician. That's a huge cost and time saving and convenience for people. I'd say that I think also like the kind of adaptability to local characters and local language. So that is an issue that is kind of needs to be efficiently made, so that it's easy for the end users to use, also in their language. Then another area is actually, I would say that one of the biggest wins could be sharing the internal resources. So sharing of a specialist doctor or sharing of another like translator, a child doctor, elderly people, clinician, so when they need it. So using this, we offer this alarm system, so that it could be also for UNDP task people working. So if you need certain type of resource, so you could with push of a button summon that person present, kind that skill present in your situation. Or it could be even like a women doctor or male doctor in some cultures. You really, if you need to have a nurse, it needs to be a certain sex, so that you don't kind of cause any kind of damage. So it's really kind of like how to help the field work of UNDP in the task. So that would be actually a quite interesting solution that could be delivered fast.
Thank you all. I'm not sure, panelists, if you can see the chat window, but we've got two further questions. If you feel free to jump in there. First one, what are your internationalization strategies for your solutions? Specifically, do you regard Singapore as a relevant and attractive market? And kind of linked to that, as an investor, it seems like many of these good healthcare solutions end up being local or in best case, regional successes. Are you seeing your solutions becoming global successes?
On, I just go again, sorry. Like in Dignio's case, definitely we want to become a global company. What we see is that as we work through healthcare organizations, we need to have a strong partnership deployment strategy. It's we are active now in Norway and in UK and in China with own teams, but we see like if we wanted to go into another market, it's very doable to do from a technical point of view, but you need to have the feet on the ground to train the healthcare personnel and to see, like it has been described here earlier, exactly where does it fit into the patient pathway in those specific countries. So definitely a huge international potential for the solution, but we also then need good partners to help us take the solution live in those countries.
I would like to add on yes to both questions.
Yeah, so from my part with virtual bed, as I said in the presentation, you know, we can set up an instance of this in around a day. All the infrastructure is set up through scripts, so that's a push button. So we can deploy it to, you know, any jurisdiction that has a suitable cloud provider. And then in terms of the internationalization of the UI and the patient experience, all of that is abstracted. So with the you know, the knowledge that PaloIT has, this is something that that we do very, very frequently for a number of projects. So we have a cyber insurance product that's rolled out globally, you know, in different languages in different countries, and you know, it's very, very easy to create a new version because all the internationalization is abstracted from all the business logic. So it's something that's you know, technology is not the problem here. You know, finding the right partners and people who want to roll this stuff out is the hard part.
Thank you. I think that's a good point to end on. Alice, if you don't mind just turning on your webcams just briefly, just so we can get everyone on the screen. Great. Let's see if there's any other questions. We've got one more question actually from Mikhail. What is the path to success in other markets than home markets? Is it partners? What kind of partner? And are there any other obstacles in succeeding in other markets?
Yeah, I could take that and answer also to the internationalization question. So basically, what we are doing is that we are looking for distribution partners for local technology kind of enablers, and have connections to the healthcare or other relevant industries over there. So kind of that kind of intersystem integrators, health service providers, and other local partners to offer them with the value-added messaging products on Ninchat.
I think we're going to wrap up there. We are going to share the recording of this session and all of the slides kindly presented by the companies here by email in the next day or so. Vidar,